Recorded now. Recording has started. Okay, hey, thanks again for that reminder. We did want to record this because we do have some people who couldn't be here today who did want to, hopefully watch the recording. So, yeah, again, this session we're focused on the first 90 days of 2023, which is, a lot. So, yeah, and then next slide, Nate. Our topics today. So number one, like who is Rising Stars, right? We're gonna touch on that, and then our conference schedule. What are the 4 days in November? What are we gonna touch on? So hopefully you can make all four of them, but if you can't, if you need to juggle, which understood here in Q4, you'll know which ones are most important for you. Um, this presentation today, the one specifically today, is mainly conducted by our team, the RWC team. So we're gonna do some quick intros, and we'll definitely let Mick do an intro as well from a Rising Stars perspective. The next three sessions will be some will be co-led by us, but some will be mainly led by other entities like a Hyperlift or someone else. We're trying to pull some partners into these conversations too, so it's not just us talking um, to make it hopefully even more insightful, right? Um, we're going to talk about what's before the first 90 days. So, the first 90 days will be that's the main topic, but we still have some time. We have a little runway before we get there, and there's some really important things we can and should accomplish to kind of pave the way for an even more effective Q1. And then those kind of big topics in Q1, we're going to get kind of deep into retention, satisfaction, and loyalty. Which think about onboarding, reboarding, OEP, and then CAPS conditioning, and then there's a lot we can do around Part D and HEDIS and the foreign language TTY measure. And then really importantly, I think bid strategy. So some tips around bid strategy and how to work with the organization um, to positively influence that. And then lastly, some information around goal setting. Really important and really important to do it, near the beginning of the year, obviously. All right. So with that, what is Rising Star? So quick blurb here, right? And Rising Stars, if you've hopefully seen them, but we've had a video podcast for several months now. We finished season one, and it's a so Rising Stars is actually an entity that's formed, and it's between RWC, which is our firm, and Hyperlift, which is a Stars performance management company that a lot of our clients use, and um, and we've ended up working together a lot over the past few years on several clients and developed some really strong synergy, which you'll hear probably more about on Thursday. Um, but relevant to today is just the fact that we've created this thought leadership enterprise where we are looking to share helpful content. That's all, right? So we do that through these video podcasts. We do these through conference discussions that we facilitate, pre-conference workshops that we facilitate, and in virtual conference like this one that you're participating in today, and down the road, hopefully in 2023, maybe even an in-person conference. But we are focused on this one today, and really excited for you guys to uh, to be here. And then I think next is the schedule. So these are the 4 days, right? Today, again, kind of the Q1 checklist, right? So what do we need to do for stars in Q1 around all those things we talked about? Session two is Thursday, and you should have that on your calendar. If not, send us a note or put your name and email in the chat, um, and we'll make sure and forward that to you. So Thursday we're gonna get into Stars Performance Management. This is gonna be led by Hyperlift, and not so much like leveraging Hyperlift's tools per se, but leveraging Hyperlift's expertise around they work with a lot of plans around performance management. How do you leverage dashboards and performance management reports to really guide your stars program, and inform the whole organization strategy around stars, um, as well as tracking and acting upon the not just the measures that are heavyweight or low performing, but which measures really really can influence the quality improvement measures most, or the reward factor the most. Looking at these measures through a lot of different lenses to determine which ones are the most important measures for your contract to improve your overall score. It's not always the heaviest weighted measures. It's not always the lowest performing measures. It's not always the ones that are closest to the next threshold. There are a lot of lenses that you should be looking through to be determining that strategy. And then several other things on here as far as developing a glide path and understanding the impact of the 2 key outlier deletion methodology. We've talked a lot about that, and Hyperlift will be sharing a lot of information on that on Thursday. Session 3 will be on November 15th, so we actually have a week in the middle, some space for you to digest all the things you learned right in the first week. But on the 15th, we're going to start off with culture. Culture is a big topic that we're having with virtually every client these days, and something that is arguably the secret sauce, right, to doing well in stars, is to having that strong organizational culture of quality. And we want to get tactical here. We want to give you some real tips, some real practices on how do you align leadership, which in our studies is the most important thing you'll do to improve stars, having leadership aligned, and having an engaged organization. It's not easy, and it's a lot harder in some organizations than others, but there are things we can do to improve that, as well as innovation, being maniacal around data, around follow through, around being member centric, etc. And then the concept of measure ownership and accountability, goal setting, all those things as they build into establishing a culture. And then the final session on the 17th is going to be, and there's not a lot on here yet. We're still, fleshing this out and creating slides, but it will be around the member experience, which is, the most important thing in stars. It's 60% of stars. And it's going to be at least formed around the concept of the voice of the member. How do you capture the signals that give you the voice of the member, and how do you leverage those signals to improve your organization? Anything to jump in? Anyone have any feedback here, or anything I missed? Okay. And then next, so we'll just really quick intros here, just so you know who we are, because we work with many of you, but not all of you. So some of you are kind of friends of the family or friends of the family, and so really excited that you're here. But we, our firm, we're stars. We're a quality improvement consulting firm, and really focused on creating cultures of quality within health plans. So we work with a lot of health plans, and kind of, if you look at the topics around the wheel here, those are the key levers that we help engage within the organization to help create that culture. So program development, health equity, organizational engagement, governance, and strategic planning, all to drive increased performance, retention, member retention, obviously revenue from quality bonus payments, and the overall customer experience. And then I won't go any deeper into this. This is not a sales pitch. I just want you to understand kind of who we are and who's doing the presentation today. So then there's a slide for each of us. I won't go into this either, but it does. What I'll say is, well, I guess I'll do a quick intro on me. But so led stars for a plan for about 5 years, a 4.5-star plan, multi-state. We had a great group of partners, a great organization, great engagement, and left that company about 6 years ago and started a consulting firm, and have grown over time. And that was about 6 years ago. And in the last few months, actually, have brought on some really skilled, really seasoned people to help grow and to help serve all of our common clients. So that's me, and I'll shift right to who's next. Is it Luis? Luis, can you introduce yourself?
Hi, good afternoon, everyone. My name is Luis Cerda. So pretty quick, I've been working with stars for about 10 years now. I started at a company called MCS in Puerto Rico, and then for the last 4 years, since 2018 until earlier this year, I was working with Cigna, and I've been working with Rex since then. So very nice to meet all of you.
Thanks, Luis. And then Nate.
Hey folks, Nate Lucina here. I joined the firm about 6 months ago. Before that, spent a lot of time leading quality analytics and data science, as well as some strategy and operational functions. And so excited to meet all of you who I haven't met yet, and excited to continue to work with everybody that I've already been having fun with in Starsland.
And then Jess, I know you're in the car. Are you able to do a quick intro, or do you want me to do it for you?
Yeah, no, I can do a quick intro.
Okay.
I actually stopped to just log in and everything. Yeah,
Oh,
Jessica Murator. I'm in upstate New York, so Rochester, New York, and most recently came from Centene Corporation, where I oversaw a lot of the market performance for 38 different health plans. Was in RFP and implementation. I had three health plans actually reporting up through me. And then I came from MVP Healthcare before that. It's a regional plan in New York and Vermont, where I actually entered through the utilization management department. And so my focus there was a lot of audit specific activities. I was the main point of contact for all of the utilization management state and federal audits, and then NCQA, and was able to lead the company through full survey, successfully lead through a full survey. So a lot of different type of experience, and I do really have a strong background in compliance because prior to my healthcare career, I was in the legal field.
Thank you, Jess. And Mick, I know we're gonna we'll hear a lot more from you in a formal introduction on Thursday, because the presentation's all pretty much all yours on Thursday. But as part of the Rising Stars Enterprise, so we talked about, it's a combination of partnership between RWC, our company, and Hyperlift. So Mick is the CEO of Hyperlift. And Mick, can you introduce yourself?
Sure. Hey, everybody. My name is Mick Toomey, and I lead Hyperlift. And as Rex was saying, we work together with a lot of customers, clients. It's a good balance between the analytics and the scorecards that we provide and the expertise that Rex and the rest of his team provide. So it's a really good marriage, and I think creates a good value equation for the customers and clients. So happy to be here.
Thanks. And then I think we're getting into just a couple more slides on kind of to ground us on stars, right? So there's some key issues facing MA plans today, right? So number one, member experience, right? So we have a whole session on this later, but it's arguably the most important thing going on right now. I mean, it's more than half a stars, so it's hard to say it's not the most important thing. Though it's influenced by a lot of different things, from the way we engage with our providers to the way we design our bid, to the way we manage our vendors, to et cetera, et cetera, et cetera, right? But delivering that best-in-class member experience is incredibly important and incredibly challenging today. Also, engaging and aligning with those internal partners and providers. So we talked about the importance of leadership alignment and organizational engagement. We can't be good at stars without that either. And then next is data, right? So stars is a data-driven program, and we have difficulty collecting, managing, and leveraging relevant data. So from wherever, right? From providers, internally, from vendors, in a way to make it actionable and performance oriented. And then, obviously a growing item of importance, right? Helping members cope with social risk factors. It's always been important, but it's now it's in every regulation that CMS drops on us, and will continue to grow and continue to be more important. And we are definitely that's definitely a topic that we're helping to address a lot these days, helping to have a data-driven approach to health equity. And then the constant pressure to innovate partnerships and plan designs while managing costs. So, innovation is something that that we're seeing, the plans that innovate more are the plans that perform higher in stars. And there are some headwinds when you're expanding into new markets where that becomes a challenge. And actually we see innovation dropping when plans are expanding, which makes stars more difficult to reach. But, you know, we have some great studies around that, and but that's a constant pressure. And this all, you know, leads up to health plans facing these incredibly complex challenges in achieving and maintaining big time stars performance goals. And then real quick, this is just, what does good look like, right? So, you know, we work with a lot of plans, and it's a lot of 4 and 4.5 and 5-star plans, right? So we get to work side by side with a lot of these plans who are doing it so well, and you know, and so there is a design, right, of what a good plan looks like today. And it probably evolves over time as the STARS program changes. But, you know, there is a category of organizational excellence here where it's all about culture, a formal governance structure, that relentless maniacal focus on everything, on data, on measures, on follow through. I mean, we see clients, you know, when they're in the chart chase process, right? They don't stop until they find the last A1C in the right A1C, right? So, but they know who the member is, where the test was done, where to go, and it's really a maniacal focus. And then flawless execution of everything in their control, that operational excellence. Not easy, but something that is definitely a key pillar. And then foundational capabilities. So, you know, predictive analytics has definitely become table stakes. This is not something that only the high performing plans leverage now. And then these plans are also focused on removing barriers to care and high performing vendors. So having high performing vendor partners and really having a strong oversight of those programs. And then next, customer centricity, right? So all about the voice of the member, improving the member experience, engaging with members in the right way, whether it's in their preference, in their channel of preference, you know, where they are, et cetera. And then customer service excellence. So ensuring that, you know, customer service drives a lot around satisfaction and around the overall experience with the health plan. And then lastly is the provider, right? So having these collaborative engagements with providers, having robust provider incentive models, and not just the incentive amount, but the whole strategy around how do you engage providers in these incentive programs. And then how do we support providers? How do we equip them? How do we embed clinicians into their teams or support them with a staff pharmacist, et cetera? Okay, I think this is Nate, right?
I think so. Yeah. So Rex alluded to this sort of introing this session. So as we were talking through this, you know, we're going to go through some things that are, you know, really helpful to get your arms around in the first 90 days. But some of the assumptions that we have to make about that is that, you know, our plans are taking care of other things before that first 90 days, right? So laying the groundwork in Q4 and sometimes Q3 of the prior year to make sure that you're hitting the ground running on January 1st of the measurement year. So some key considerations, and again, Q4, yes, but some of this should even happen earlier. So budgeting. I know in my prior life, we started, you know, trying to get our arms around what the budget was going to look like in June or August or September. But certainly as you get on into November, there's some room to incorporate the findings that you've gotten from your latest comprehensive STARS rating to understand, you know, what are the places where we might need to pivot? What are the places where we might need to overinvest in order to mitigate a headwind? And make sure that is all squared away so that, again, you can hit the ground running on 1/1. Contracting. I personally, and I'm sure nobody else has had this happen to them, but I personally have gotten to 1/1 not having contracts finalized for very important activities that I needed to start. It is not my favorite. It's not fun. It doesn't set you up for success. It doesn't set your vendor up for success. So really being very disciplined about engaging in that activity late in the previous year, even though understanding there's 10 million other things going on, and you're really just trying to manage that vendor or strategic partner to close out the year strong. You really do have to have that discipline to be looking forward to the next year and what that program is going to look like. Goal setting. We work with Hyperlift and a lot of clients to do goal setting throughout the year, and I think that's really important. Setting your goals for the current year at the beginning of that year is really great. But actually, once you get your prior ratings, right, in October of that year, I like to start goal setting for the following year right then. You get your ratings for the prior dates of service. You're still trying to close out the current measurement year strong. But then again, looking forward into that third stars year that you're managing all at the same time and trying to set goals based on your last available final rates, where you are at this point this year in your projections, and then looking forward into that next year can help inform things like budgeting and contracting to make sure your programs are focused where they need to be. Governance updates. All of our organizations have a lot of movement. Some of them have a lot of growth. Executives change, performance changes. And so the way that you have managed the governance of your STARS program in order to get to the level of performance you're at today might not be the governance structure that you need to meet your goals for next year. So really taking a critical eye at how you're governing that program, where the gaps are, and making strides to mitigate those or close those gaps before you start the new measurement year. And then provider engagement. Making sure that you have a handle on what your provider incentive program is going to be for the following year. There's going to be plenty of work you're going to have to do to execute on that program, right? Get your materials approved, push them out, understand what the budget is going to be. And so finalizing and promoting those provider incentives and really having your arms around what the value-based agreements need to look like in your network in order to meet your goals are kind of some essential activities to engage in Q4. Did I miss anything there, Rex or Luis or Jess?
Yeah. I don't think so.
So those are the baselines to, again, consider in the prior year and make sure that those things are set to the best of your ability so that you can move into that first 90 days with a strong baseline.
And now from a retention, satisfaction, and loyalty standpoint. So this is something that a lot of plans are focused on, obviously. I mean, retention is it's always important. Now it's a 4-weight measure too, right? And it's something that's getting harder and harder because plans are everywhere. Members have no barrier to switching, right? So if I'm a Medicare Advantage member, I have, I think, 36 plan choices on average in my zip code, and a bunch of 5-star plans in the middle of the year if I want to switch, if I haven't switched yet. So there's nothing keeping me from switching if I get the slightest whim to do so. Plus, we're less loyal, than we were a while back. So it's something that we are all focused on, and there is a difference between having a satisfied member and a loyal member, and we need both. Obviously we need to drive satisfaction, but that doesn't always make a member loyal. There are things we need to be doing to drive loyalty too. And this is a video actually, just a really short one from a panel discussion that we had not too long ago. So Nate, can you hit play here? It's actually not, I'm not hearing it. Are you guys hearing it? it's not playing. Yeah, we had this issue earlier, but we thought we fixed it.
Like I think you should start as early. Again, like we think of experience as relationships. And what I mean by that is when you get a new friend, what you don't do is like have one contact and then don't talk to him for 3 months. He ain't gonna be your friend anymore. Right? And so that's exactly just how human relationships work. Once you make a friend, you call them back the next day. Hey, how's it going? How was your day? And that is exactly the way we want to kind of think about it, is that they are jumping into a relationship with your brand. And once they jump into the relationship, it's both of like the plan's job to kind of manage and maintain that relationship, because there's a lot of other people ready to take that business away. And so you have to be building that relationship through your onboarding program, just to make sure, kind of the point Blake made, like the HRAs, making sure the doctors, the benefits, and it's during the holidays, right? Who wants to talk about healthcare during Thanksgiving? Everybody wants to talk about turkey. So one of the things which we think about, right, is between like Thanksgiving and the New Year, there is this time period where people are traveling. So a lot of the things which are top of mind is, okay, I'm traveling, healthcare, how do I make sure that when I'm traveling, everything is good? And so if you don't reach out, they are going to be reach out. Like, for example, we have benefits around Fitbit and Purse and all that. We get so many calls just to make sure it's set up. And that's really the key, is like understanding human behavior, understanding that it's a relationship, understanding what's the context in their life, which is vacation, people might be traveling, there's a lot going on. How do you keep it succinct? That's how we kind of think about like onboarding, especially during the radio silence period.
So this was Archie Day. Archie is, many of you probably know him. He's been in the industry a long time. He's at Scan Health Plan. He's the Senior Director of Consumer Experience and Insight. So he's very involved in Stars, but he owns the consumer experience. And he was on this panel with us, and I loved what he said there. You know, and you know, it's on the plan to manage this relationship, right? So I think many of us, and I know I have been in the past, you know, guilty of having an onboarding strategy that involved a welcome call, right? And a welcome call, right? A single welcome call that if we made 3 attempts and didn't reach them, we thought that was okay. I mean, that's, you know, they get checked off the list basically like it's completed. And you know, we end up reaching maybe a third of all of our members, right? You know, on a good year. And but it's one 15-minute conversation, 20-minute conversation, and a bit overwhelming typically because there's so much we want to pack in there. The script is long, and you know, and we've gotten better probably over time at managing that process, but still, you know, I would just challenge you to really look at your strategy and get super involved in that onboarding strategy, super involved in and I think, you know, I was talking to Liz Haynes, I don't know if Liz is on, but the other day, and she was like, you know, make sure you look in the welcome kit, right? Like, make sure you are involved in that process, and you're informing that process, because, you know, we have marketing teams, we have enrollment teams that are, you know, maybe doing a good job at executing, right, these strategies as far as conducting the calls, and maybe the customer service team, but I promise you, like, no one is going to have the perspective that you have on the importance of the experience of that new member, the experience of them receiving outreach, getting educated, becoming activated. It's not just did they get a welcome call, right? There is so much in that strategy that needs to actually start on day 0. So if we sell a case on November 1st in AEP, you know, a few years ago, like Archie mentioned in here, there's a radio silence period where we typically don't reach out to the member, that new member, even though they've enrolled with us, we have their information, you know, we know they're coming on board on January 1st. And then we might start welcome calls on January 1st and complete them. If we complete them within 30 or 60 days, then we feel pretty good about that, right? That means that member's been sitting there from, you know, November 1st you know, all the month of November, the month of December, maybe the whole month of January, and maybe into February before we reach out to them. And, you know, again, back to what we mentioned earlier with there are no barriers to switching these days. There are, you know, lots of choices, and buyer's remorse kicks in quick if that person came from a plan that was maybe not serving them poorly, but maybe you have an attractive benefit that kind of pulled them in. You know, you need to not rely on that attractive benefit to keep them, right? You need to engage them from the moment they step in your door and treat them like a friend, and not just make one call, but have a series of interactions, well thought out, small interactions from day zero, you know, all the way through the first few months of enrollment. And that can involve the broker, that can involve the sales agent, that can involve, you know, a lot of different entities, which we'll kind of touch on here. And then as far as your strategy itself, right? This is where, do you, like, I guess I would ask you, do you have an onboarding strategy that's actually documented? Not a welcome call script, you know, not a list of contents of the welcome kit, but do you actually have a documented strategy on how you want to onboard members, and how you want members to feel, how you want them to experience the onboarding? This is what, you know, we encourage STARS teams to work with those cross-functional partners like marketing and enrollment and customer service and provider network and medical management, et cetera, to design, to document a desired member onboarding experience. What do we want members to feel at the end of it, or when they're going through it, and then orchestrate it. We talk a lot about journey mapping, right? Where we want to kind of capture what does the journey look like, where are the pain points, and that's important. But I think more important than what I'm hearing more and more, I'd say progressive and high performing plans focus on, is not mapping it, but orchestrating it. How do you, you know, how do you actually design the experience the way you think it should be based on feedback from the members and voice of the member feedback? So it's not just you thinking this is how it should be, but it's actually informed by your members, and then orchestrating that, right? So how do you actually document it and orchestrate it with these cross-functional partners that you need their buy-in, because they're doing the execution on this largely, right? But really, really important. Nate, this is you, right?
Yeah. So, you know, a couple of the things that are that we've been talking about, both that you heard Archie talk about very eloquently, because as I seem to recall, that session was at like 8 a.m.
In Vegas, yeah.
In Vegas. But you know, and Rex was talking about a little more formally. These are not just like feelings that we have from dealing with clients. This is empirically supported in research. And so, you know, DEFT did a really great study about Medicare open enrollment period and disenrollment prevention. There is, if you haven't seen this study, there is a ton of slicing and dicing of Medicare membership during open enrollment, and looking at members who were kind of rapid switchers versus those that weren't, and whether there were variables about their interactions with the plan that seemed to determine whether or not they would have kind of a longer tenure or not. And so the spoiler is that yes, all of those things do tend to matter, and they do so in very reliable ways. So one of the most important things is members who did not receive proactive outreach from their new health plan are significantly less likely to be those non-rapid switchers. And then members who contact their plan first, so members who have to reach out to their plan, we could make the assumption that it's not just out of curiosity, but because they actually need something from their plan and haven't heard anything from them. Those members are significantly more likely to be classified as OEP switchers, right? So rapidly switching from the plan they originally enrolled in into a different plan. And certainly there are a lot of other variables that kind of tend to flow in there and have an impact, but that is one of the biggies. Additionally, members who receive that outreach from their plan are also more likely to understand and be satisfied with their coverage. That is actually relevant here. Sorry, we'll fix that before we send it to you. So in terms of members who receive outreach from their plan, they actually, this is all self-report, they say they're more likely to say that they understand their coverage completely, so on a scale of 0 to 10, than members who did not receive any outreach from their plan. And then additionally, they're much more likely to say that they are completely satisfied with the benefits that are covered under their plan than those who the insurer did not reach out or did not return their phone call when that senior reached out. This previous graph, don't pay any attention to this text over here on the left, but what's important to know about this is that the timing for when those members enroll actually tends to be very telling for rapid disenrollment. And this is a point that Rex kind of pulled out of that study to tell us. But you can see that during October, early November, you're down in the teens. And it's not exactly a linear relationship, but it's pretty stair-step that when you get to late November, it's up over 20 into the mid-20s of rapid switchers, and then when you get to early November or early December, it's somewhere around 30%, which is significantly higher. So these two variables, right? Whether or not a member has contact with the plan after their enrollment, whether they had to contact the plan themselves or they received proactive outreach, and then the timing of that original enrollment. These are all really important variables that you can monitor in order to understand what the risks are associated with those new members that you're getting, and plan and orchestrate a true strategy to outreach to them ahead of time before they need you. And that can have significant benefits for those members in preventing them from rapidly switching away. Particularly when we think about this graph of members who say that they understand the coverage that they're getting from their insurer and that they're satisfied with that insurer's help in understanding it. When we think about a lot of the CTMs or grievances that we get in the first 90 days, particularly from new members, a lot of what we hear when we dive into potentially the verbatims from those calls, right, is members calling in a lot, clogging the call center because they don't really understand their benefits. They don't know how to access the things, the coverage that they need. And so to the degree that you can do that outreach proactively, and make sure that they do feel like they understand their coverage and are satisfied that they understand it, that can also reduce some of that activity that's flowing into your call centers at times that are already very, very busy for them.
And then back to sort of the holistically orchestrating the new member journey. And actually I wanted the little arrow up in the top right. Nate, you didn't really touch on that, right?
No,
just to kind of orient you to that, the reason that's there is because if you think about all of these as a checklist, right? There could be, like I mentioned earlier, like we could have like an onboarding strategy could be conduct welcome calls, right? Just check the box. But there's so much more within that decision, right? Or within the concept of conducting a welcome call. So, and if you imagine for everything that we talk about today, every activity, every STARS initiative that you have, right? It's not just do you do it or don't you do it. You really because the 5-star plans in maybe some of your measures where you're 5 stars, right? If you're not a 5-star plan, it's not a check the box. You're not just saying, yeah, I did a welcome call. It's well thought out, well orchestrated across partners with content, with with a well thought out script across several touches, probably, right? Including maybe different partners, including the broker and customer service and who maybe a vendor, right? But different outreaches, including the HRA, et cetera. But there's this spectrum of how well you're doing it, how robust it is. So are you just checking the box? Yeah, I'm doing a welcome call. I call everyone. I have a script. Right. If I can't reach them, then I mark them as complete and I'll move on. Or, I have a well thought out strategy. Of these 100 members in my plan, I reach 35 of them with with a phone call, about 35%. But the other 65, I have a strategy to get the information to them in some way. And then, a series of onboarding steps for everyone, not just including the phone call. So it's, on the spectrum, you can either be just check the box, yes, I'm doing it, or it can be really well thought out, more comprehensive, more robust. And the further you move to the right of that spectrum, the more impactful that initiative is going to be. It's not just checking the box. You have to do more, right? If you want to be above the norm, above average in the market these days. So I wanted to orient you, like we have just kind of that box sitting at the top of every slide, just as that reminder, like, am I just checking the box here? Because, some plans will say, yes, I'm doing that already. But when you dig in, you realize they're really not doing it very effectively, right? They could be, maybe they're, a football analogy, they're making it all the way to the 5-yard line and they're stopping. They're not going into the end zone. They just need 5 more yards and they would get so much more impact from that initiative, but they stop short. So it's something to think about, when you're hearing these and when you're designing your own interventions. So if you imagine a new member onboarding journey, this is some of the more important ones, right? Pieces of it. And Nate touched on this one already, but empowering new members to use their benefits. We saw some, information from DEFT on this, on the importance of this, but, this is where it's not enough just to welcome a new member into your plan now, especially with all of these supplemental benefits that we are investing a lot of money in and a lot of resources in managing and helping to get those on board through the bid strategy, through implementation, through vendor management, and God knows through procurement and legal, right? Which is there's a lot going into getting these programs on board. Let's make sure our members know how to use them, right? Let's again, not enough just to welcome a new member. We need to ensure they understand their benefits that we've invested in on their behalf, that they're activated in those benefits, that they're empowered to use those benefits through being activated. So, imagine one example is a new member comes onto your plan, and in one of your first outreaches, right around the effective date, you actually help them conduct or place their first OTC order. So you're not just telling them about the OTC benefit and saying, hey, there's a catalog, or hey, there's a website of things that you can get. You're actually helping them place the first order and getting them vested into your plan, getting them, a sense of ownership, and which creates loyalty, which helps them understand the plan better, helps them start utilizing the benefits more quickly. And there's a lot of power in that. Next, an obvious one, connecting members with the PCP, right? They join your plan typically to access care. I mean, that's what your plan is for. That's the biggest purpose that we serve as Medicare Advantage health plans, is ensuring that our members are able to access care. And connecting them early with the PCP, with a high quality PCP, ideally, right, is a really important step early in the process. Same thing around specialists. So helping to identify specialist needs. Do they need to be engaged quickly with a cardiologist or an endocrinologist, or whatever else, and help to coordinate that through their PCP. Help to get that ball rolling, to get them engaged, to have no gap in care. For a lot of reasons: clinical outcome, medical loss ratio, member experience, stars measures, right? The whole 9 yards. I mean, the more we coordinate that care quickly and don't have a long gap, the better we are, and the member is, and our plan is. Alert members to available incentives. I mean, this is one that is typically baked into the welcome script, but important to help them understand do we have incentives in place? New members aren't eligible or not eligible for the CAPS survey, so it's not going to drive CAPS satisfaction, but it does drive overall satisfaction and loyalty, and hopefully, HEDIS outcomes or whatever we're incenting them to do, annual wellness visits, etc. But ensuring they know and understand that helps them not only be able to benefit from that, but helps them see us in a more positive light as well, which is never a bad thing. Develop a strategy for initial HRAs. So really important to do this, to have the HRAs conducted early on, obviously, from not only a regulatory standpoint, but the value that we get from these. And another place where we can create stickiness too and get partners involved early in the process. Another example of maybe on day 0, if a member came to us through a broker, right, are we potentially incenting that broker to help facilitate the completion of that health risk assessment? A lot of plans do it, a lot of high performing plans do it, to really, jumpstart that process early on of getting them not only engaged with the plan, invested in the plan by sharing information, but also by self-reporting important things that we need to know around clinical programs to get them involved in, as well as the very next box to the right there, to identify social risk factors. So not being done in mass across the market, but is being done by the highest performing plans who are really focused on, how do we really collect social risk factor information on members, from members, for members, so that we can leverage that to help them remove barriers, help them to have better access to care. So using HRAs to do that, to have questions in there addressing social risk factors is a definite best practice. And then educating members on preventive care gaps, right? Helping them to close those early, and to manage their care long term. Anything I missed here that anyone wants to jump in on? Nate, Luis, Jess? Okay. And then reboarding. So we talked about onboarding a lot, right? So we have plans ask us, so which is more important? We don't have an unlimited budget, so which is more important, onboarding new members or having a reboarding strategy or welcome back strategy for returning members? And I would argue that it's some of both, right? It's not one or the other. If your pain point is rapid disenrollment, if that's your biggest pain point that you really want to manage, then you're onboarding, onboarding for especially high risk members that are at risk of leaving soon, that you can identify through predictive analytics. That's arguably the most important intervention that you'll have to address that. If your pain point is around the CAP survey, then your reboarding strategy is more important than your onboarding strategy, because it's the people that are being reboarded who come back in their second year and beyond that are CAPS eligible, right? Those are the ones who get the survey. And really the importance of, or the objective of, the reboarding strategy is to increase understanding of plan changes, and to increase CAP scores and to prevent OEP lapses, right? So we're seeing more and more disenrollment by existing members during OEP, and something that definitely plans are trying to manage, but also trying to do the things necessary to increase CAP scores. And again, right, working with those cross-functional owners to document and orchestrate a desired reboarding experience for your members. So what should that look like? What do we want that to look like? And maybe it's different for, we've seen plans conduct or create a different strategy for year 2 versus year 3, or maybe year 2 and year 3 have the same strategy, and year 4 and beyond has a different strategy, so that members feel something different, and they don't feel like, I'm just getting the same call I got last year. There's something different about it. They know me better, right? I've been engaged with their plan for a longer period of time. so the value is perceived in the call being a little bit different, a little more unique for me, right? So I think that's really important to not have just one script for, even if it's versioned out by product. I think it needs to be versioned out somewhat by tenure of the member, again, so that they feel like it's something different and feel like it's something specific for them that they're going to actually benefit from, and not, I had this call last year, so I don't need to do it again. Nothing, there's nothing new going on, so I don't need the call. So conducting targeted re-welcome calls to high risk cohorts. So again, if you can't do both, if you can't call all of your new members and your returning members, identify who needs them the worst, right? Who needs them the most? So which of your existing members that are coming back, maybe which ones had the most negative plan changes, based on your bid for that year. So which ones are going to be impacted the most? Let's do a reboarding campaign to those to ensure they understand, to ensure that they know alternatives in addressing those negative changes, so that when they get the CAP survey, they're not full of negative surprises that have happened in the last couple of months because they didn't know about the plan changes that you made because you put it in the ANOC, but they didn't read the ANOC. So how do we make sure that those high risk people, high risk being high risk of performing lowly on the CAP survey or maybe leaving during OEP, how do we make sure the members that are high on those lists are not high on those lists? How do we mitigate that pain that they are potentially going to feel? And again, with no negative surprises, which we kind of already talked through. Anything else on reboarding that anyone have any questions or anything to add? Okay. So this slide, and credit to Predict Health, one of our partners that we do a lot of work with, but they've done some big studies around members who left plans, disenrolled, right? Voluntarily disenrolled. And they were able to create this model of at what places in the journey, or which places in the journey are most influential in determining whether or not that member is going to stay or leave. So as you can see here, 30%, the biggest chunk, 30% of whether that member is going to stay with our plan or leave our plan is in the sourcing or the pre-enrollment phase, which really goes back to, how was the sales experience? Were they put in the right plan? So the plan match fit, which is a bit of a challenge because if you are using multiple national call center brokers, FMOs, and your own internal agents, I mean, many of them probably have their own algorithm to match a member with a plan, and they're not all the same. Some will include like the value of supplemental benefits and whether or not your supplemental benefits make that plan a good match for that member. Some don't include supplemental benefits. So as much money as you're investing in supplemental benefits and a flex card or a food benefit or whatever that might be, some brokers are not even considering that in the value of your plan when they're trying to match it to a member. So to dig in and really understand that and to influence that as much as you can, right? Because if they are not put in the right plan, then the odds of them leaving soon go up astronomically, because something will happen where, the care they need is too expensive, or the provider they need is not, the specialist they need is not in the network, or something, or the drug they need is not covered, or it's in a really high cost tier, or something like that, right? Something will indicate to them, this is not the right plan for me, I need to go somewhere else, and they'll leave. But if they're put in the right plan, that's 30% of the battle already. Another 25% is made up in the onboarding process, between onboarding and the actual enrollment. Were they enrolled in the right plan that they actually enrolled for? Did they receive their correct ID card, etc.? And that whole onboarding strategy, did they feel like the plan helped them and educated them and empowered them to use the benefits that they've enrolled in? hugely important. 25% by itself is made up in accessing care. So, you know, this is kind of after the onboarding process, but it actually could be part of the onboarding process if they needed to go to the doctor or get a prescription during that time. But that vertical all by itself was 25%. So were they able to not just find a doctor or a pharmacy, or you know, or get their drug, make sure, or you know, access their medication, their Part D benefits, and actually for a drug that was actually that they needed to ensure it was covered, but could they even find a PCP on your provider finder, on your online provider directory, right? Could they navigate it? Could they, you know, could they actually, was it friendly enough to where they could actually use it to find a PCP or a specialist, or maybe even a pharmacy, right? But because sometimes they're not. These are, if I asked you, you know, how many of you have an online provider directory that's challenging? If you know, if 9 out of 10 of you didn't raise your hand, I would think you're probably lying, right? Like some of us maybe have one that's okay, but the vast majority of plans that we talk to don't. It's just something that the provider data is not accurate, not timely. It's the navigation of the site's not friendly, and that all feeds into, or it all influences whether or not they can access care. That's just one example, right? And then contacts. So when they have a problem, this is 20% of the likelihood of whether they stay or leave. When they have an issue, how much effort does it take to resolve it? You know, can they, if they maybe try to chat or try to solve the problem by looking online in your FAQs, but they can't find it and they have to call, you know, they weren't planning to call. That wasn't their first intention, right? Their first intention was to solve this on their own using the information that you have, or to chat, you know, maybe in between tasks, you know, with someone. But if you don't have that functionality, or you don't have a well constructed FAQ section on your website, and they can't find the answer and they have to call, they're already, you know, expending more effort than they plan to. And then if you have a long delay and they can't get someone on the phone for 2 or 3 minutes, and then they're put on hold or transferred to someone else, just, you know, you've been in those shoes, right, of trying to solve a problem with customer service. And the less effort they have to spend, the more, or the, you know, the more likely they are to stay with your plan, right? So let's invest there. Let's get involved there, you know, as stars and quality teams. Let's influence our customer service experience and make it as effortless as possible. It's an investment worth making. And then next slide is Luis, I think, right?
Yes.
Hey, Luis.
You can just keep going on that one. Yeah. So when we're talking about CAHPS conditioning, we want to attack this or address this from 3 points of view. Internal, which means your staff, your teams, what we're doing with the member, and what we're doing with the provider. So internally, you definitely want to have all the key teams take the CAHPS survey that is available. You can use the copy from last year, and you can ask them to answer this. And when I'm thinking about key teams, I'm thinking about stars, of course, network operations, pharmacy team, your clinical team, customer service, grievances and appeals, etc., and everybody else that you may think of. It's important for them to understand the complexity of the survey, how long it is, how long does it take for them to answer that, and the kind of questions that people are going to be asked. And I will definitely tell those members, hey, put yourself in the position of your elderly relatives, like your mom or your dad, your grandma, when you're answering this. Like, really think of the services that we are providing here. Like, do you think this is really covering and getting what the members need? And that is important because whatever the case is, you want that feedback from your internal teams in order to make sure that you're making the changes that you need. Another thing is you could be conducting a CAHPS week And to me, this is part of the bigger scheme, which is the STARS culture. I'm not going to get into all of that right now. We have a whole session that is dedicated to that. But some things that you could be doing on a STARS week is, for example, making sure that you are informing all of your staff, everybody in the company, about the survey, what the survey is all about, why this is important, how does it impact STARS, etc. You can start your training sessions during that CAPS weeks. You could have daily activities for your staff. For example, doing some sort of community service if you're not already doing that. You could be visiting elderly people. You could be doing all sorts of activities with them. You could have some contests. Like you could be asking the different teams, hey, let us know how you and your team impact CAPS, or let's have a contest about who has the best ideas for us to improve CAPS, and whoever wins that contest, we're going to make sure that we implement that idea. We'll give you some sort of prize, etc., etc. You also want to provide start the training for customer service. Remember that customer service is probably one of the areas that will impact CAPS the most, because it's not just that customer service measure, but also rating of the health plan. They might even, depending on the questions that they get, they might even impact rating of the drug plan, or getting needed prescriptions, medications, all of these things. So you definitely want to make sure that your customer service is top of the line, and they really understand how to help members and do their best in order to have a positive effect here. When we're talking about the members, you can develop a pre-CAPS improvement letter. And when I'm thinking about that improvement letter, I'm thinking about two things here that you can do. That letter definitely can help you inform your members about what CAPS is, when it's going to happen, why it's important for them to answer this survey, to complete it and return it. And you can also use a CAPS improvement letter to let members know of all the things that you have been doing to improve your services and to make sure that all of their needs are covered. I'm not sure that I'm going to include those two things in the same letter, but definitely make sure to let them know that this is important, and make sure that during the year, you're letting them know about all the things that you're doing for them. You could be doing things like sending them a Valentine's Day card. And when we're talking about that, it's more about that tender, loving care. Like, make sure that you demonstrate that you care about your members. And this is something that it's very simple, and it goes a long way, especially, for example, for those members who may be alone during that day. Receiving that card is going to help them a lot. It's going to lift their spirits. It's going to make them happy, and it will definitely be reflected in their answers here in CAPS.
And Luis, sorry,
yes.
Can I jump in there and say one thing?
Of course.
There's actually a DEF study. We've quoted DEF a lot. They should be giving us a commission or something probably, but there's a DEF study that actually studied, among many other things around loyalty, the impact of a Medicare member receiving an actual hard copy actual greeting card, like a Hallmark card in the mail, and it did the result was that those members did think more fondly. They had a more positive perception of their plan. It didn't necessarily study loyalty, actual statistics as far as retention, but just, the members in their mind, what were you thinking when you got this? Did you think it was cheesy? Did you enjoy it? Are you glad you received it? Did you think higher of the plan? And the vast majority was that. I'm glad they sent it. I really appreciated it, and I had a higher perception of the plan. So that Valentine's Day card is, some of you may think that's nothing, that's kind of cheesy, but it actually, there is some impact there for sure. How much of it plays out into a CAPS increase or retention increase, it's hard to say. Probably not tremendous, but I think it's something, right? And every little bit counts. So, all right, thanks, Luis.
Thank you, Rex. The next bullet point: strategically determine timing of making or collecting payment to members. I will say any kind of strategy that your company is going to implement, you should be aware of, and you should be asking people, how is this going to impact my CAPS? Is it going to be a positive or a negative impact? But in this one specifically, I will summarize that by saying, if you are making a positive adjustment, like there's a reason why you need to return money to members, before CAPS is the right time to do that. And if you are going to make a negative adjustment, well, you say, hey, for some reason we need to collect money from you, then try to do that after caps, because of course that is going to impact member perception for sure. And it was mentioned before, promote those incentives. You can do that through letters, or especially make sure that during their welcome calls, you are talking to the members about the incentive programs that you have, what they need to do in order to earn those rewards. And also make sure to reach out to members who are potentially dissatisfied. Try to gain their feedback, understand why they are dissatisfied, see how much assistance you can provide, try to solve the situation right there and then. And if you cannot, make sure that you follow up with them. That's a good way to show good faith, saying, hey, we know that there's something that is bothering you. We're here to help. We want to help. We want to understand what is happening. We're going to do everything in our power to help you. And then when it comes to the provider, you want to do education and awareness. I think this is the perfect time to discuss with your providers the result of the mock surveys. I was having a conversation with somebody actually before. I do not believe that you should just go to any provider and say, hey, guess what? Our contract H1234 got 75% in the annual flu vaccine measure. You should do something about it. They will say, I do not relate with that. I don't know who answered that. I don't know if it was even my patients. I am doing that all the time. I'm telling my patients to get the flu shot. But if you conducted a mock survey, this is the perfect time at the beginning of the year to take those results and tell them, hey, we know exactly which members answered this. We have the results here by provider. Discuss that with them. Make sure that you put those numbers in front of them and make sure that you discuss an action plan for the rest of the year with your providers. And finally, identify the providers that have more capacity to complete those annual wellness visits. And I think Rex mentioned this before, so I'm not going to go into all of that. The only thing I will say is, yes, we want to complete those annual wellness visits as soon as possible. And you want to tell your members that you can help them coordinate those appointments. But if you know that specific provider may not have a lot of capacity, you don't want to start sending a lot of people to that office or to call there, because that is going to impact your measure, getting appointments and care quickly, right? Any questions, comments, anything that I have left out this discussion? Okay, I think that we can go to the next slide then. Okay, so let's talk a little bit about Part D, HEDIS, TTY, and foreign language, things that we believe you should be doing in those first 90 days. So let's begin with Part D. And when I say Part D, I'm talking specifically about the 3 meta-adherence measures, SUPD, and the MTM CMR. So we're going to make a couple of assumptions here. We are assuming that you included the Part D measures in your PCP incentive. If that is the case, remember that you need to accompany this with effective reporting. And specifically for adherence, you want to let them know which of these members are recoverable, how many days you have to comply, and for these members to become non-recoverable, which medications are needed, so they can follow that information. They can call the members and they can schedule those appointments and make sure that they are prescribing the medications that they need. Something very important, and I learned at my last experience with a health plan, you want to leverage your health plan pharmacists in the conversations with the PCPs. Believe me, it will do wonders for your results. Having the pharmacists having conversations, talking to the PCPs and explaining to them the things that they can do is usually better received than when, for example, I, as a STARS team member, was talking directly to the PCPs. So I would recommend that you do that you leverage your pharmacists. We're assuming that you have an adequate pharmacy network and that you have partnered with those pharmacies to conduct member outreach somehow. You can decide to do this in conjunction with including the measures in the PCP incentive, or you can do it separately. Definitely, it's up to you. I remember listening to a health plan a couple of years ago where they said that they delegated adherence 100% to the pharmacies, and they were paying the pharmacies to call members, to get them into the pharmacy, to pick up their prescription, and they were doing all of the follow-up. One of my previous experiences, we were doing both. We were including this in the PCP incentive, and we were also working with all of the local pharmacies to contact the members, reach out to them, and make sure that they were picking their prescriptions and that they were compliant. You also want to identify the members that have the highest risk of non-compliance in both adherence and the SUPD measures. And the way to identify those members is, for example, those members who have more than 10 medications, members who have a long history of non-compliance, members that you know have issues with money, and usually those are the ones that, again, have a lot of medications, they hit the coverage gap sooner in the year, and also the ones that you know had a PDC, sorry, very close to the 80% the year before, right? If you have the chance, have dedicated call centers to provide reminders. Have them call these members, let them know, hey, Mrs. Jones, hey, Mr. Smith, you are due for a refill of your prescription in the next 10 days. This is the medications that we have on file that you are taking. This is the pharmacy that you're supposed to go. Is there anything that you need? Do you have any questions? Those reminders help a lot. A lot of people, and there's also a good way to engage with the member. There's also a good way to get feedback from the member. So definitely try to do that. If you cannot have a call center in-house, you can leverage a vendor to help you manage these non-compliant members, whether it's SUPD, whether it's med adherence. And again, you can, for example, target those members that the previous year had a PDC between 65 and 79. And those are the ones that you want to start calling first. So you make sure that this year they comply. And you can also leverage a vendor to work on your MTM CMR measure. And finally, make sure that you are maximizing the IVRs or the text message reminders. Again, when you're doing this, make sure that you are talking to your teams to make sure that you avoid member abrasion, because they are not getting text messages left and right from all parts of the health plan. And finally, the last topic I wanted to make.
Did we lose Luis?
I lost him.
Yeah, Rex, I think we did.
Yeah, I thought it was me, but something.
Rex, you're on mute.
Okay, I'll just do this slide. Yeah, I was saying I just got kicked off too. Oh, there you are, Luis.
Can you hear me? I'm sorry, I don't know what happened. My apologies.
We hear you. Yeah, go right ahead.
Okay, so the last topic that I wanted to talk about is the heat chart chase. I know this is something that a lot of people don't like. You are just beginning the year and you are trying to get in touch with everything that has to happen. And now you have to go back and start working on what happened last year. So definitely you want to, when you're working on your medical record review project, you want to make sure that you establish a goal per week. So you want to know how many chases you need to get for each of the measures. Remember that most of the time, like these measures, you only need to get, you have a sample, I'm sorry, of 411 members. So you start that project in February, knowing how many hits you need for each of these measures. So know how many chases you have to look for, know how many providers you're going to be working with, and how many weeks you have to complete the project. And based on that, you're going to establish a priority. So you definitely want to go for those measures that need more chases and the providers that you need more chases from. As you're doing this, make sure that at the beginning of the year, you're communicating with your providers and you're making them aware of the importance of the project. Remember that pretty much everybody's going to be asking them for this information. So they're going to be very, very busy. You want to let them know what is the expected volume of requests from your company that you're going to be sending. And also to just ask them for stuff. Also let them know what support you have to offer them and the support that you are expecting from them. Something that we were discussing these days, as we were talking about the topics that we wanted to mention here, is maybe this is something that you're doing, maybe not, but you can try to identify other internal sources that you have available that may contain information for your medical record, right? Like the risk adjustment files. Sometimes you can find information there, like documented HEDIS services and codes, lab values. There might be information there that you can already use because you have it available. So make sure that you are working with your RA team to get that information as well. maximize the remote EMR access. You usually have this access for your care coordinators, or you can work with a vendor, for example, like Ciox or Credo. As much information as you can get through the remote EMR, please do so. And then also leverage any PCP portal that you may have available for them, or any FTP that you may have available for them, so they can send you all of that information. It's not written in here because I don't really believe too much in this, but worst case scenario, if you need to get the information through fax, then at least make sure that you have a fax cover sheet to provide to those PCPs or to these institutions. So when they send that information to you, you know exactly what you are getting, and you can process that information a lot faster.
Are you saying you don't believe in fax?
I mean, not that I don't believe in fax, but on this day and age, like we really want to be using faxes anymore. I'm saying, like, worst case scenario, if you have to, I had to several times when I was working with the health plans, but it's definitely a little bit of a headache.
Yeah.
Questions or comments here? Okay, I think I have one more slide. Okay, call center and the TTY. I was looking into the results, and most of the health plans here perform very well, 4 or 5 stars in these measures. But if you have not performed very well, a couple of things that you can do. We're assuming that you have a reliable vendor. The one that I know of is Service Language Line. If there's anybody here who's working with another one that has helped you a lot, please let us know in the comments, or just you can say the name out loud. We will definitely like to see which other ones you recommend. Make sure that you and your team review and understand the CMS guidance for these measures. You want to understand what is the time regulation, how many minutes you have to connect with an interpreter, and you want to understand the accuracy of responses requirement. What is CMS actually asking? Something that you can do that I remember doing, in the past, is work with the director of customer service, telemarketing, whoever in your company is getting these calls, and you can have a log of the questions that you are being asking. You can create a log like, hey, these are the questions that we have received in the past. If we receive a question like this is how we are supposed to be answering that question. Based on that, make sure that you coordinate those trainings for the teams who are going to be getting these calls, and do mock audits. At some point, I remember doing this with a vendor. I will leave that up to you completely, but I think this is something that can be managed internally. You or somebody from your team can conduct a couple of mock audits calls. Just call your call center, your telemarketing teams, and make sure that they are at least connecting with Service Language Line or with the other company that you're using within those 8 minutes. Very, very important. Review these processes with your IT department. Make sure that all of these lines are available. Make sure that the transfer protocols are in place and they are working. Make sure that everybody knows what they have to do. Make sure that they are available during those couple of months that the evaluation goes on. They're available to help you with whatever issues you may have. And finally, if you're working with your vendor, make sure that you are receiving a daily report of how these calls are going, if they understand that you pass or you fail, why or why not. And if you see anything that doesn't look right, have a conversation with the manager, with the director of customer service, telemarketing, to make sure that you are making adjustments as soon as possible. Questions or comments here?
Okay, thanks, Luis. Okay, so 7 minutes and 2 topics left, and I'll make it really fast through bid strategy, and then Nate has the last one. So bid strategy, right? So the question here is your entire, think about your entire bid strategy team. Think of who all's in the room, coming up with the details around the bid strategy or that will be soon for 2024, right? For your 2024 bid. And are they all on the same page regarding the following, the things on this graph, as far as their relative importance and their relationships with each other? Because we want to increase the things in the left column, meaning access to care, activation of members through benefits, through cool supplemental benefits, attractive supplemental benefits. We want to increase their understanding of all benefits, right? To minimize confusion, to improve access, to remove those barriers. We want to increase necessary utilization, so preventive and chronic. We want to increase member retention, want to increase innovation, provider performance. Kind of all roll into star ratings, right? So our quality scores. While at the same time decreasing things like cost and unnecessary utilization and complaints and the negative impact of all of the things down below. So, and apologies for some of the formatting here. This looked perfect every time we've looked at it, and we shared it on SharePoint. We've been, trying to minimize version control here or maximize version control, and it resulted apparently in, when we go into presentation mode today, some things off kilter here. So sorry, we'll clean that up before we send it out. But we want to decrease the negative impact of disruptive changes from things like if we're forced to make a service area reduction or a PBP closure, or just a key change like a provider termination or a PBM change or an OTC vendor change or key benefits changes or premium premium increases, etc. So negative changes we want to reduce. Some of these things we can't do things on both. Like it's hard to improve quality and reduce cost at the same time sometimes, right? So if our driver as an organization is cost, that's going to present barriers to us in being high quality, right? So there has to be a trade-off here, and Medicare Advantage plans need people like you. If not in the bid strategy room, they need you informing the bid strategy team on what's really important. So the point of, and while we're doing all this, we're also managing the three things on the bottom, right? We're not trying to necessarily increase or decrease them to certain levels, but the medical loss ratio, risk adjustment, and growth and expansion, right? So we want to grow and expand, but there are headwinds that come with that we have to manage. So we have to balance growth with quality, with cost, etc. But the main objective here on this slide is to make sure your team. So if I'm you, I'm going to encourage you to be the owner of your bid strategy orientation program, right? This is something we're developing for our clients heading into 2023, but an orientation program that really gets everyone on the same page regarding what is most important for our organization right now. The phase that we're in as an organization right now, heading into 2024 benefits, what are the most important things for us? Are we 3 or 3.5 stars? Do we need to jump to 4? Is that the most important thing? Then we need to sacrifice some of these other things. And it's all a trade-off, but it needs to be well informed, and you need to make sure that everyone understands what is most important right now for our organization. Okay, last 3 minutes, I'll turn back to Nate for some goal setting.
Yeah. I already alluded to this earlier. Click on through here because we'll cover it in painstaking but very interesting detail on Thursday. But setting goals for stars measures in Q1, we work with a lot of clients and trust us when we say we understand all of the data challenges that come with managing a stars program. Sometimes you don't have the data you need earlier in the year. But to the degree that you're able and really push yourself to get all your historical data, and either whether you're building it internally or working with a vendor, really intense goal setting that incorporates your measure champions, your measure owners, incorporates your analytics organization and all the partners that are going to be carrying portions of this star rating throughout the year, making sure that you are taking historical performance, all of the cut points that might be shifting around, how your peers are performing and that industry distribution is looking, to come up with measure-specific goals that roll up to the contract level goal that you need to achieve. And for those of you that are managing multi-contract plans, does that roll up to the enterprise star level that you need, for instance, if you're going into expansion mode and really need to rely on that parent 4-star. So this is a nice segue actually into some of the information that Mick and his team will cover in our next session, and certainly we'll jump in with thoughts as necessary. But this is a really important activity to engage in to make sure that your organization from the top to the bottom understands what the goals are and are unified around them, so you're all working in the same direction. All right.
Awesome. Hey, thanks. Thanks, Nate. Like Nate said, next session's Thursday. If you don't have that on your calendar and you want that, again, stick your name in the chat or send us a note. Really excited that you were all here. We will look forward to continuing the conversation on Thursday and then on into the 15th and 17th. We are recording this, so we will, happy to send out the recording and a copy of the slides as well. Okay. Any last comments or questions? Okay. If not, thanks so much for joining us, and we will talk to you Thursday.
Thanks, Rex.
Thanks, guys.
Thank you.
Thank you.